sometimes the injuries are minor or sometimes the injuries are major. Okay, अगर major होगा तो क्या होता है, you get a fracture. Okay, fracture होता है. So when your bone is swelling or it is having some displacement, that time it is having a pain, and that pain is leading to fracture. Okay, so what is a fracture? Fracture is nothing but the broken part of the bone or the swelling of the bone or the displacement of the bone which has taken place due to the accident is known as a fracture. Now here in this picture you can see that the child has fall down on the ground while playing, and his leg has been swollen, and as well as it has become reddish in color. You can see it, the wound has become reddish in color, as well as it is swollen also. So when there is a fracture, we can see this type of changes in our body. So this is the swelling of the bone is the uh, symptom that tells you that there is something problem in your body. Okay, then discovery of x-rays. Now when there is any damage in your bone or any part of your body has been affected due to the bone, that time we can identify these things by taking out x-ray. तो हम लोग एक्सरे निकाल के देख सकते हैं कि क्या प्रॉब्लम है बोन का, बोन को कहाँ पे डैमेज हुआ है, एट विच प्लेस द बोन हैज गॉट अ injury. So all this thing can be seen with the help of x-ray. So x-ray is very much helpful, but before that you must know that who has invented x-ray. So x-ray was first time invented by William Conrad Roentgen in 1895. So in 1895 this scientist had invented x-rays, and due to his invention we are now easily able to find out the which part of the bone has been damaged, and doctor can immediately start the treatment for the injury where it has been caused. Okay, now and in x-ray you can see the images of the bone in the x-ray. अगर आपने x-ray देखा रहेगा किसी का भी, अपने मम्मी का, दादी का या ग्रैंड पेरेंट्स का, किसी का, तो you must have seen that x-ray is nothing but it is a formed an image of bones. तो आपके bones का जो image होता है ना, that is seen in x-ray. So you must have seen this x-ray. The William Roentgen, he first time invented the x-ray and took the photography of his wife's hand ring because she had a fracture there. Okay, so this is about the great scientist William Conrad Roentgen, who invented the x-rays in 1895. Now because of him the doctors can treat the patient properly and give the treatment to the injured part of the body where actually the injury has become there. Okay, so this is about the lesson. Now as we are talking about the skeletal systems and bones, as you all know that there are 206 bones present in our body, and in child, in a small baby, there are more bones than 206. तो 206 से भी ज़्यादा bones जो present होते हैं, that are present in a newborn baby, because the bones are not joined. As the growth takes place in that child, the bones get joined, and when the child has become an adult, that time he is having 206 bones. Now as we are talking about bones, we also should know that the bones are of different shapes and size. So according to the shape and size of the bones are classified into four different types, that is long bone, short bone, flat bone, and cylindrical bone. So these are the four different types of bones which are uh, shown in the picture. So flat, long bone, you can see the bone, according to the name, the bone is longer in size. short bone. According to the name only, the bone is also short. Then there is a flat bone which is present, and even the cylindrical bones. Cylindrical bones are cylindrically shaped. Now here you can see the classification of the bones on the basis of the shape. So shape के basis के ऊपर bones are classified into long bone, short bone, irregular bone, flat bone. Okay, so these are the classification of bones done according to the basic shapes. Now here we are going to talk about the two different topic, that is appendicular skeleton and axial skeleton. Now ये जो brown color का जो part है, that is the appendicular skeleton, and जो सेकेंड पिक्चर में आपको जो ब्राउन कलर में इंडिकेट किया है, दैट इज योर एक्सियल स्केलेटन. सो वी आर गोइंग टू स्टडी अबाउट द टू system, that is appendicular system and axial system. So the skeleton system is divided into two different type, that is appendicular skeleton as well as axial skeleton.